Hey, what's going on, everyone? I hope you're all doing absolutely fantastic. And in this video, we're going to talk about a really common disorder or syndrome in India for women that's called PCOD, Polycystic Ovarian Syndrome. We're going to talk about what are the symptoms to detect it, what are the tests that are there to find it out, what are the cures, what are the treatments that can be done, what actually causes this thing as well. So let's get into it. Polycystic ovarian syndrome is a hormonal disorder that is found in women at the reproductive age. That's generally the limit in which it occurs, where different symptoms occur, like the most common ones being irregular menstrual cycle, difficulty in getting pregnant, excess growth of hair, and the excess amount of androgen, the male hormone found in women. How much this syndrome or disease or situation is common in India I'm specifically talking about, then it's about 1 million per year cases that are registered in India for this particular situation. So it's not just common, it's very common. So if you are someone who's trying to find out whether you have PCOD or not, some of the symptoms that you need to look for is that whether you're having excess hair, because as a woman, the androgen, the male hormone, is supposed to be less or controlled, but with this particular situation, it goes above and beyond and creates all these hormonal disorders. The other thing that you're going to observe is irregular menstrual cycle or absolutely absence of that. So when I say irregular, it could be either a couple of months. In the case of 1 month, it may get to a couple of months, 3 months, or 6 months, or even a year. So those are the indicators. And the third and another vital indicator of PCOD is, of course, if you're getting difficulty in getting pregnant, because the whole thing happens around the ovary. These are the things that you can look for. Let's just touch upon the thing that what actually is the thing. I mean, what is the materialization of this syndrome? Is that what it's found in most cases, that the ovary, from where the egg ovulates in women, that forms small to big different sizes cysts, and thereby blocking the ovulation of eggs for women. And that's why the name comes from polycystic, that is multiple cysts, ovarian syndrome, that is multiple cysts on or in the ovary, that sort of syndrome. So before we get into the cure, first thing that I want to mention is that if you somehow suspect that you're going through PCOD or PCOS, then the first thing for you is to seek medical attention, because there are tests which are internal tests, so which observes the internal parts of someone's body, and also there are some lipid profile tests. Along with both of these, the doctor can actually confirm whether you are actually having PCOS or PCOD. So first thing first that you got to do, and when you're done with that, there are certain medications that are given to start out the ovulation, sometimes oral contraceptions and sometimes some specific medicines, so that the ovulation and the menstrual cycle is jump started. That's one type of cure that doctors might prescribe, and the most important thing that doctors would prescribe, and most of the cases, or most women who go through PCOS and try to recover from that go through, is the lifestyle change. So the two major things that are going to affect your getting recovered from PCOS situation are activity, and the other is stress, because these are the two things that are going to regulate your hormone more than pretty much anything. Of course, your food habit and everything, those all things come in your lifestyle change, but these two are the most important. First of all, you got to observe that if you're having PCOS or PCOD, there's a big chance you're obese. So that's one of the other causes that recursively affects PCOS to increase. So you got to increase your activity level. You got to start doing physical exercises. If you're doing it, maybe have to increase it. Of course, do all these things with the help of medical supervision. I'm just giving you the guideline. The other thing that you got to do is, of course, and it's perhaps more important than the physical activity, is reducing your stress level. That's why it's a down arrow. So it's been shown in different clinical trials that if you reduce the stress level, that is your cortisol level comes down, then your androgen also comes down, and your whole PCOS situation can be alleviated single-handedly based on the stress. So there's also another chance for you to kind of self-analyze that if you find that you're having PCOS, you're probably having stress also. And the interesting thing is, the moment you find out you're having PCOS, because it's a condition and you know that you have to recover from it, it gives you even more stress. So it's, again, a recursive thing that can affect you. So the people who can actually help you are the closest to you. So try to create an environment which is always joyful, enjoyable. There's not much of a stress. As human, we always go through stress. It will always be part of our life. But what I'd suggest is that, because you've got to recover from that, just to try to shut down the windows for the stress areas, try to go somewhere, have some vacation, meet friends, people who can cheer you up. And those probably are the things that are going to affect your path to recovering from PCOS the most, apart from the medication that the doctors might prescribe you. So, and last, I just want to close it with a remark that if you're having PCOS and if you detected you got PCOS through medical tests or just by self-analyzing, don't worry about it. It's a very common situation in women in India and actually all over the world. But the good news is that it's very much recoverable through medication and very much recoverable through your daily activity. So the things that I mentioned, just keep those in mind. Don't follow this video as a blind following guideline or something like that. It's just an overview. Do your own research, and most importantly, if you think that you are having PCOS, do consult a doctor to confirm on it and take the next steps of changing your lifestyle or taking medication. I hope this video was helpful. If it was, please leave it a thumbs up and share it with the people who might want to have more benefit out of this video. And do subscribe to my channel if you feel like. Have an awesome life, folks.